So I believe today we're talking a little bit about the medications that are available for Alzheimer's treatment, and also medications that I can tell you that are in the pipeline, getting ready to be available if the FDA approves of meds that are in the pipeline that are getting close to applying for FDA approval. So I mean, I could just tell you what the 4 or 5 medications approved for Alzheimer's currently, and then we're done, right? Give you the names. Actually, what's actually more interesting is maybe talk about how these medications work, why they're approved, and what they actually do to your brain. Wouldn't that be better than just me giving you a list of names of meds, which you can probably Google up? So what we can do is I'll give you a little bit of background on how our brain works. And once you understand that, how the brain cells talk to one another and interact and all that, once you understand that, then it's just pretty natural why these medications are approved for Alzheimer's treatment and meds that are in the pipeline. Does anyone know a few names? And feel free to type it out in the chat box. What are some names of medications that are FDA approved for Alzheimer's? Does anyone know? If you do, type out in the chat box for me a few names. Yes, Sandy. Namenda's one. What are some other ones besides Namenda? Any other names? Yes, Namzarek. Yes, that's probably the latest one. Although that's really just a combination of 2 other approved ones. What are some other FDA approved meds, guys? Any other names you can think of?
Aricept.
Aricept, yes. Aricept, got it. Does anyone know the generic name of Aricept?
No, I don't.
There's a generic name. It is, I'll spell it out for you. It's the Donazepam. You guys have heard these names before, right? There's some more. There's some more meds that are FDA approved. Anyone know what these other ones are?
Oh, recently the expensive one.
Yeah. Aduhelm, that's the latest one. Yes. Exelon. Yes. Do you know the other name for Exelon, the generic name? Anyone know that one? I'll type it out for you. Exelon is this one, rivastigmine. And there are any other names? Yes, Ben, absolutely. Galantamine. Do you know the brand name of galantamine that's attached to that?
I don't remember. I only remember the generic because that's what my wife was taking.
Yes. Here's the brand name. I'm going to type it out for you. And it's Razudine.
Razudine, yeah.
Yes, that is the other one with that. And of course, Namenda, the other name for Namenda is Namenda's memantine. And I'll type that out for you as well. Let's see. Yeah, I mean, this is all just a list of names, right? Which most of us will probably just forget by the time we're done with this. What you really want to know is why they work and how they work. So in a normal brain, in a normal, healthy brain, we each have a bunch of brain cells. Anyone know how many brain cells the average brain has? Anyone know the number of brain cells most of us have?
I think
didn't
it's
say
100 billion.
yes. 100 billion. 100 billion, which is quite a bit. Look at the numbers, zeros behind that, right? In the chat box. 100 billion, quite a lot. Still less than the national deficit, but quite a bit. And not to say that we use all those brain cells, right? we use a percentage of that. Some use more than others, but 100 billion brain cells. And these 100 billion brain cells, what they do, guys, is that they're always talking to one another. They're always chatting with each other. One brain cell will chat with the next brain cell that's next to it, and they'll chat with the next brain cell that's next to it. So our brain cells are always communicating with each other. Every time we're thinking of something, our brain cells are communicating and chatting. Every time we have a feeling about something, our brain cells are communicating and chatting with one another. So every thought we have is a pattern of brain cells talking. Every feeling we have is also a pattern of brain cells talking. Every memory that you have, they're basically patterns of brain cells that are connecting in your brain to form like a memory. Does that make sense to you guys so far? Right? Pretty straightforward with that. Let's take it one step deeper. And the one step deeper is, how do the brain cells talk to one another? Right? So here's brain cell A and here's brain cells B. How do they actually talk to one another? I mean, they're not like yapping. How do they talk and communicate to one another when they're communicating? Right? So, do you remember the old days of the Pony Express, how mail was delivered? Right? We've all seen it on TV at some old show, right? The Wild Wild West. Obviously, none of us have been around during the Pony Express, but you know what I'm talking about when I say Pony Express delivering mail, right?
Mhm.
So in the old days, before the post office existed and the mailman existed, to get a message from one person to another, right? Somebody got on his horse, grabbed that message, and horseback to like the next home to deliver the message. That's the Pony Express, right? They were delivering it through the Pony Express. So your brain cells, the way they communicate is that they're delivering messages from one brain cell to the next brain cell using what I call the Pony Express service. That makes sense so far for you guys. It's the brain cells own Pony Express service. And that pony, right? That pony that is riding along from one brain cell to the next brain cell to deliver these messages, that pony has a name. Does anyone know the name of that pony when it comes to our memory? Anyone know the name of that pony that delivers messages that helps?
Is it the
Okay,
nerves?
what's that?
Nerves? Your nerves?
Well, the nerves is the actual brain cells.
Okay.
right? The nerves is the actual brain cells, but for our brain cells to talk to one another, there's a message that needs to be delivered, right? There's a
Mhm.
message that needs to be delivered, and there's a pony that runs across to deliver messages. That pony runs everywhere. Electrical impulse. Well, the electrical impulse doesn't actually deliver the message from brain cell to brain cell. The electrical impulse delivers the message from one end of the brain cell to the other end of the brain cell, right? Through this axon, we call it, right? Kind of like a highway. So the electrical impulse delivers that message down the brain cell. But what delivers messages from actual brain cells to brain cells? What is that pony called? It's chemicals, yes. Well, it's a, it's a protein. It's a protein, yeah, if you want to call it a chemical. A synapse is just that gap that's in between the two brain cells. In between the two, I don't know, in between the two nerves, the two neurons is the synapse. That's the gap, the space, right? But there's actually a pony. This is like Jeopardy, guys. This is like Alzo C Jeopardy, right? That pony has a name. Here it is. I'm going to type it out. And there it is in the chat box. Acetylcholine. Acetylcholine. Anyone ever heard of that before? Yeah? What have you heard about it? What do you know about it?
That's the thing that has in myasthenia gravis that blocks the nerve endings from
Yeah.
firing. Because my
Okay.
daughter has that, and my daughter has myasthenia gravis.
Yes. So acetylcholine receptors are affected. The receptors are affected in myasthenia gravis. Yes. So acetylcholine is the pony. Okay, that helps specifically to deliver messages that are connected to memory, not just any message that are connected to memory. Okay, is everyone following me so far? Type in yes if this makes sense so far. The pony, right? Sandy, yes. Stephanie, Megan, Kim. All right, very cool. Acetylcholine, right, is the pony that brings the message and kind of helps to, it kind of helps basically, it doesn't bring the message, but it helps the brain cells to talk and to connect when it relates to memory. So if you want to stabilize and improve your memory, do you want more, right? Does myasthenia gravis have more brain problems? Well, myasthenia gravis is in the brain, but it doesn't necessarily increase. I'm not sure if it increases the rate of Alzheimer's having myasthenia gravis. That's more of a motor function, musculoskeletal issue. So if you want to improve the symptom of memory, if you want to improve your memory or improve the symptom of memory, do you want more ponies or less ponies? What do you guys think?
More.
Or,
You want more ponies, right?
or,
Okay. Yeah. So you want more ponies because the more ponies you have, right? The more ponies you have, basically the more messages can be kind of, connected, right?
Mhm.
With that. So how do Alzheimer's medications work? The ones that are FDA approved. Okay, of the list that we have. What they do is they increase the number of ponies in your brain. We call them cholinesterase inhibitors. What does that mean? There is an enzyme called cholinesterase, and that enzyme basically breaks down the acetylcholine that's created, right? So when you make the pony, right, when you give birth to the pony, that pony grows old, it does its job, and then that pony eventually kind of dies, right? It gets shut off so that you can make more ponies. So the enzyme that basically takes away the pony, the enzyme that takes away the acetylcholine, right, is called cholinesterase. Cholinesterase is the name of that enzyme that takes away. I'm gonna type it out for you guys here. Esterase is the enzyme that takes away your pony. And okay, and that pony is acetylcholine. So if you want your pony to work longer, last longer, and have more ponies, what you do is you stop the function of the enzyme that takes away the pony. That makes sense for you guys so far? If you want your ponies to last longer, right, to function longer, then you take away the enzyme that breaks down or takes away your pony. That enzyme is called cholinesterase, right? And cholinesterase takes away acetylcholine. So you want to inhibit. Inhibit means stop, right? You want to inhibit cholinesterase. Okay, so these medications that are FDA approved, they're in categories of meds called cholinesterase inhibitors.
Okay.
Now, which ones of the ones that we have listed so far is a cholinesterase inhibitor? Do you guys know which ones of the ones we have listed?
Namenda?
No, not Namenda. Namenda works a little bit different. So the ones that are cholinesterase inhibitors are, there's three. The first one is donazepam, right? Aricept is a cholinesterase inhibitor. The second one is, I'm typing it out for you guys here. The second one is Exelon. That's a cholinesterase inhibitor. And the third cholinesterase inhibitor is Galantamine or Razid. So of the 5 now, right, medications that are FDA approved for Alzheimer's, 3 of them basically keep the pony alive longer so it can carry messages about memory. Makes sense to you guys so far? So those are those 3, okay? That's what they do. They keep your pony alive with that. Now, of these 3 medications, of the categories of Alzheimer's, between mild, moderate, and severe, do you know what these medications are approved for? Which category? Anyone know? We can start with Aricept. Is Aricept approved for mild, moderate, or severe Alzheimer's? Yes, the acetylcholines can keep working longer before they die. That's right. The ponies, we increase the lifespan of our ponies. They'll eventually die, but these medications increase the lifespan of our ponies. Okay. Yeah, Aricept is typically given for mild Alzheimer's, but I think the FDA have expanded its label so that you can use it at any stage. But normally it works best in mild, okay, mild cases of Alzheimer's. Exelon is approved for mild to moderate Alzheimer's. So Exelon is for mild to moderate Alzheimer's. Okay. By the way, Exelon is also approved for Parkinson's dementia. Parkinson's dementia is something that's also approved to be of use for Parkinson's, Exelon. Okay. The third one, Galantamine, which is Razidine, that's also for mild to moderate. Okay, Alzheimer's is what it's FDA approved for. Since they're all in the same category of cholinesterase inhibitors, you should know that they all have the same side effect profile because they're in the same category. Okay, what are these side effect profiles? Anyone know? Potential side effect profile. I see dizziness, Sandy. Okay. What are the common ones? So the common ones that we see is normally GI side effects. GI side effects. Nausea, vomiting, loss of appetite, and sometimes diarrhea, cramping and diarrhea. Okay, so cholinesterase inhibitors cause commonly GI side effects. Appetite issues, nausea, vomiting, diarrhea, cramping. Make sense so far, guys? So those are the ponies. Now, Namenda, right? Namenda is a medication that is specifically approved for moderate to severe Alzheimer's, right? Moderate to severe Alzheimer's category is Namenda. Namenda works differently. Namenda works basically through what we call the glutamate regulators. I don't want to get into the weeds too deeply with all these different names, but basically Namenda regulates the activity of glutamate, and which is a different chemical messenger than acetylcholine. Okay, it's a different messenger than acetylcholine. So you can say it's a different pony, right? It's a different pony. And that pony is called a glutamate pony. Okay, different pony. On the horse category. And so Namenda works specific for that pony, the glutamate pony, and is approved for moderate to severe. Makes sense so far, guys? So what are some side effects of Namenda? Anyone know? Side effects of Namenda. Any thoughts on that? So Namenda is a different pony, so it has a different set of side effects. Number one is headache. Okay, headache is fairly common. Sandy says, what happens if someone takes Namenda, has mild Alzheimer's? Nothing bad will happen. It's not uncommon, actually. It's not uncommon for patients to be on both medications. Somebody who is on Aricept is also on Namenda. It's not uncommon to do that. And that typically is okay. Sometimes in super mild cases, we would just start off at Aricept alone. And then if the symptoms of memory loss progress, then we add on Namenda. But it's not uncommon. I've seen neurologists all the time mix both medications from the start. Combination therapy, right? So the side effects of Namenda includes headaches. It includes constipation. Constipation is opposite of Aricept, which causes diarrhea, right? Namenda causes constipation. It can cause some dizziness as well, is what we see. Okay, so those are the common side effects of Namenda. Now, if I took Namenda and I created one pill that includes both Namenda and donazepam together, right? If I combine both pills together, I basically have created a combo pill, which is called Namzaric. Namzaric is basically a combo pill that has both pills in it. Sandy, I think you're asking, is it unusual to start off with Namenda and then add Aricept? It's not unusual to start off with Namenda. It's not unusual, and here's why. Very often, more often than not, in the primary care office, when we make a diagnosis of Alzheimer's, very often our patient is already in the moderate stage. Very often our patient is in the moderate stage already. We often in the community miss the entire mild stage of Alzheimer's all the time. And the mild stages of Alzheimer's can last for many, many years before a patient becomes or progresses to the moderate stage. The mild stages can last for many years. Why do we miss the mild stages of Alzheimer's? Does anyone know? Why do we miss the mild stages of Alzheimer's?
Is it denial?
Yes, it is, because we think it's normal to have memory loss. We think it's part of getting older. We tell ourselves it's called, a senior moment, right? How many times do we have senior moments, right? We call it senior moments rather than Alzheimer's. That's why we miss it. It's misdiagnosed.
Also, patients need to learn to cover it up as well.
Covered up really well. Yes, yes, very well. Sandy asked which two drugs make up the combo pill. It is Aricept, which is donazepam, and Namenda, which is memantine. Those two drugs make up the combo pill. But yeah, unfortunately, in the community, the diagnosis of Alzheimer's is made way too late. In the moderate stage, which is why oftentimes we start off with Namenda as the medication rather than Aerosol. Yeah, does that answer your question? That makes sense to you guys? Yes. Okay. Yeah, we truly need to go out and emphasize the need for early on, memory evaluations, early on memory assessments. Medicare pays for this. Medicare pays for memory testing every year, right? Unfortunately, most doctors in the community are not checking memories. Type in yes or no in the chat box if you've had a memory test by your doctor in the last 12 months, right? By your primary care physician. Yeah. See, this is what I mean. This is what I mean. This is why the diagnosis of Alzheimer's is in the moderate stage by the time we catch it. Because everyone on this list, right, except for maybe Gail, everyone on this list has a no. Right? What age should you get routine memory check? Well, we know that Medicare pays for it, and that starts at age 65. But you can get a memory check anytime that you are concerned with your memory. Anytime that you're concerned with your memory, get it checked out. I mean, we can give you reassurance if your memory check, turns out really good, and we can give you reassurance that your memory is okay. Or we can tell you that, yeah, we noticed some changes in your memory. The memory check does not include a brain scan, right? So if you just notice the number of no's in folks who are on just this little chat group here, doctors are not checking, which is why we're missing the diagnosis until the moderate stage, right? I know Alzo-C checks. Isn't Alzo-C has some programs that essentially includes memory checks. Am I correct, guys? Ben, Melissa, and you guys?
Yes, you can call our helpline. We do offer memory screenings as well.
Yes, memory screening. What's your phone number? The hotline.
I will put it in the chat.
Great. So if your doctor is not checking your memory, right, we're gonna have a phone number for you right here in the chat box. There you go. The Alzheimer's Orange County hotline number is right there, 844-373-4400. And you can get your memory check with Alzheimer's Orange County if your doctor's not checking. And we can tell you how you did. We can tell you if there's a concern, no concern. We can give reassurance if you do well, right? So this should be done every year, guys, every year, because at least you get a baseline on how you did that can be compared, right, with future testing. So that if you ever notice a change in your memory, yeah, it'll be good to make sure you have this. This should be part of every physical exam, in my opinion. And because it's not part of every physical exam, right, we have an epidemic of Alzheimer's, #3 cause of death in Orange County. We're not looking early enough. Stephanie says, shouldn't brain scans be conducted to see if there's anything in the brain? Brain scan doesn't tell you how your memory is doing, Stephanie. A brain scan doesn't tell you if you have good memory or bad memory, right? A memory test will tell you if you have good memory or a bad memory. Now, if you have memory symptoms and your doctor is concerned that your memory symptoms is from something potentially dangerous, right? Is it a stroke? Is it a tumor? Is it something that may be concerning with this memory symptom? Then yes, that's the purpose of a brain scan. is to look to see if there's any other issue, but the brain scan will not tell us if your memory is good or bad. It's just a brain scan. It just looks at the anatomy of the brain. Does that make sense for you, Stephanie? Right? And awesome. Now, you guys are familiar with the Alzheimer's plaque, right? Has anyone here heard of the Alzheimer's plaque? Type in yes if you've heard about it. Type in no if you never heard of the Alzheimer's plaque. Could an arachnoid cyst in the brain cause memory issues? Normally not. Good, okay. Most of us here have heard about the Alzheimer's plaque. What is the name of that plaque? Anyone know the name of the Alzheimer's plaque? Anyone know? You guys are an educated group. Yes, the amyloid plaque, amyloid beta, beta amyloid, right? It's got the word amyloid in it, and it's beta amyloid specifically. Let me tell you a little bit about the plaque. By the time you have your very first symptom of memory loss from Alzheimer's, right? By the time you have your first symptom of memory loss from Alzheimer's, this plaque has been around in your brain for how long? How long has this plaque been around in your brain?
Years.
What was that?
Years.
Yeah, take a guess. How many years?
20.
Yes, around 15 to 20 years. This plaque has been around for 15 to 20 years by the time a patient with Alzheimer's have their very first memory loss. Pretty crazy, isn't it, when you think about it? Super crazy. Okay, 15 to 20 years by the time. So let's say somebody in their 70s started developing symptoms of memory loss from Alzheimer's. The plaque's been around when they were in probably their 50s. It grows silently. It grows on you silently. Okay. And one day, this isn't the lecture for it today, but maybe another chat, I'll tell you why the plaque comes on, what causes plaque formation, things of that sort, that causes the plaque and things like that. But this plaque's been around for 15 to 20 years by the time you have your very first memory loss. And so of the medications that we have listed, Aricept, Galantamine, Namenda, Exelon patch, right? Of those medications that we've talked about, how many of them remove the plaque?
0.
That's correct. Until recently, right? It's always been 0, you know, it's always been 0 until recently. What is the name of the new medication that removes plaque?
Aduhelm.
Yes. Let's see. Aduhelm. Aduhelm was recently FDA approved for plaque removal, beta amyloid plaque removal, and it removes it very well, aka aducanumab. It's aducanumab. Very close, Lynn. Lynn, how did you know that long name? You're smart. Right? Yes. Aducanumab. There you go. Aducanumab was recently approved to remove Alzheimer's plaque. And that was approved, what is it, 2 months now? Is it around 2 months? I forget now. My memory's not that great. It's around there. So let me ask you this, guys. Aducanumab removes plaque. Does aducanumab, and you can just type in yes or no, does aducanumab reverse memory loss? Yes or no? Lynn says no, Andrea says no, Mabel says no, Kim says no. That's correct. It doesn't reverse memory loss. Absolutely. That's correct, Ben. Does aducanumab stop memory loss? Yes or no? Does it stop memory loss?
Should.
Mabel says yes. Ben says we don't know, yes. Sandy says yes. Okay. We got yeses, no, and we don't know here. Okay. The jury is still out. Does it stop memory loss? Okay, let me ask you this. Does aducanumab prevent Alzheimer's? Yes or no? Does it prevent Alzheimer's? Kim says no. Okay, so you guys are all in agreement with the fact that it doesn't prevent Alzheimer's. You're all in agreement with the fact that it doesn't reverse memory loss. And you're half with the question, does it stop memory loss, right? Okay. Aducanumab, the answer is this. Aducanumab does not stop memory loss. It does not stop memory loss. So you're probably thinking, then why the heck is it approved? Right? If it doesn't reverse it, if it doesn't prevent Alzheimer's, if it doesn't stop memory loss, why is it approved? Does anyone know why is it approved? Anyone know? Why did we approve it if it doesn't do any of those things?
Slows it down.
Absolutely correct. It buys you time is what it does. It buys you time. It slows down memory loss. It doesn't stop it. It doesn't reverse it, but it does buy you a little bit of time. Okay? It slows down memory loss. Lynn says, does it prevent plaque from starting? Well, it removes plaque. It removes plaque. Okay. Now, let me ask you this. How much time does it buy? If aducanumab buys you time, how much time does it buy? Anyone know? Because that'll be interesting, right? To know. I mean, is it worth it? Right? You guys know the price tag for this medication, don't you? It's a down payment for a house. Well, maybe not a house in Orange County. It's a down payment for a house somewhere else. It's $56,000. $56,000 is the cost of this. For 1 year. For 1 year, $56,000. Okay. Susan says, should people who may likely get Alzheimer's take it to keep the plaque away from the start? No, it's because it's not a prevention. This is not a prevention medication. This is a treatment medication. Okay, FDA approved for treatment, not a prevention. So how much time does it buy? When we compare in the clinical trial, what we did was we compared two groups of patients. One group taking the aducanumab, Aduhelm, the other group taking placebo, right? The sugar pill, the placebo. When we do the comparison between the two groups, by the way, this has only been shown in one of the phase 3 clinical trial. They had 2 phase 3 clinical trials for aducanumab. The first phase 3 clinical trial did not show any improvement whatsoever between the 2 groups. The second phase 3 clinical trial, when you compare the rate of memory loss, right? The rate of memory loss, the speed of memory loss, there was a difference of 22% between the treatment group and the placebo group. So both groups had a decline in memory, both groups, right? It doesn't reverse it, doesn't prevent it, doesn't stop it. There was still memory decline, but the aducanumab group had a 22% difference with the placebo group. So what this med does is that it gives you a 22% difference between the rate of decline. It's just buying you time, is what it does. Does that make sense to you guys? It's buying time as far as the rate of memory loss. So this is where the big controversy is. $56,000 for a year's treatment. It buys you at the most, right? 22% between the placebo group. Yes, Lynn says, but time is precious. Time is precious. Absolutely true. Time is precious, right? I mean, how can we put a price tag to that? What is the price tag of buying you time with your loved ones? I mean, I can't put a price tag on that, right? I don't know. I mean, I think the price tag of 56,000 is way high. I can tell you that, but I don't know what the price tag is of buying you time of 22%. That's why there's so much controversy behind this medication. It doesn't prevent, it doesn't stop, it doesn't reverse. You're buying time. Okay, but if your family is affected, if your loved one is affected, there's no price tag on that. It's hard to label a price tag, which makes it difficult, isn't it? Makes it very difficult. The doctors are all against the approval. The doctors were all against the approval, but most of the, I shouldn't say all doctors, I shouldn't generalize like that. The FDA had several committees of specialists to give input on approval versus no approval. And the committees pretty much unanimously voted against approval. The FDA overrode their recommendation of not approving it and approved it. Why did the FDA, right? Why did the FDA override their own committee? Pressure and money. Pressure. You guys are like on the spot. Yes, yes. Yes, the Alzheimer's Association was pushing for approval, right? The Alzheimer's Association represents 6 million patients and their families. Right? Think about that, guys. The Alzheimer's Association represents around 6 million patients and their families. And the argument was this: we have not had an FDA-approved Alzheimer's medication since 2003. 2003 was the last time that Namenda was approved. And I'm not talking about the combo pill, right? Because the combo pill is nothing new. It's just putting 2 approved medications together and approving it to a combo pill. That's nothing new. The last time something new was approved, right, was basically 2003, Namenda. 18 years, guys. 18 years. And so the Alzheimer's Association they're pushing for approval because in their mind, a little bit of something is better than nothing. Even if it's 22% to buy you a little bit of extra time, that 22% could mean 6 months for a loved one who's going through Alzheimer's. That 22% could be a number of months where your family member still knows your name and recognize you. How much is that worth? I don't know. But that was the pressure, right, that the FDA had to kind of go through between their scientific advisory committee that says, no, this medication doesn't really work, don't approve it, versus 6 million families who are basically saying, we don't have time left. We can't wait another 5 years. Right? Do you guys kind of see that the emotional tug and pull both ways? Right? There's 6 million families who can't wait another 5 years. And so that was the emotional tug of war, that a little bit of something is better than nothing. The question is, is that little bit of something worth $56,000, right? And so is it false hope? Is it false hope? So it buys a little bit of time, if it works at all, is what it does. Yeah, Andrea says, but decisions need to be based, off the data, driven by science and not emotion. Yeah, I hear you. Stephanie says, are they still doing work on the drugs? Yes, let me tell you what's in the pipeline. You guys want to hear what's in the pipeline?
Yes.
By the way, guys, if you are interested in participating with what's in the pipeline, just give my office a call, right? The Irvine Clinical Research, we have what's in the pipelines. If you're interested in clinical trials, just because nothing else works really good, right? Clinical trials is where there's hope. Let me put my, let me see. I'll put my office number in here. And you can definitely participate in what's in the pipeline if you're a candidate at no cost. We have a study, guys, that has actually no placebo. We have a very interesting study. It is a head-to-head study. What head-to-head means is that it compares 2 treatments. We have a study that compares Aduhelm, which is FDA approved, with another medication that's in the pipeline. We actually have studies like that, no placebo at all. So you're going to get some treatment either way with our clinical research. If you like that kind of study where it's head-to-head and you're not, taking a placebo, just give our office a call. We have those studies. We're studying Aduhelm. What's in the pipeline is very interesting. And I'll finish it off here in the last 2 minutes, right, that we have. Man, the hour just went by fast. I can't believe it. That went by really fast. What we have in the pipeline, and I've seen the data that's already been published, they are medications in the same class and category as Aduhelm. These medications, they're called monoclonal antibodies. Let me type it out for you. Monoclonal antibodies. Let me see. Okay, that is usually an IV infusion that's normally given like once a month. Monoclonal antibodies are not new. They have already been approved for many other health conditions, mainly conditions that has to do with an abnormal immune system, like rheumatoid arthritis, Crohn's disease, ulcerative colitis, multiple sclerosis, psoriatic arthritis. things that are, where your immune system kind of goes haywire. Monoclonal antibodies have been approved, also approved for the cancer treatment as well. In cancer treatment, what we do is we infuse these antibodies, and the antibodies, what they do is they go and they tag the cancers. They bind to the cancer cell, and when they bind to the cancer cell, they light up the cancer cell so that the immune system sees it and kind of gobbles it up, right? That's monoclonal antibody. It's using, the concept of immunotherapy. Immunotherapy means using your own immune system for therapy, for treatment. Cancer treatment, it's basically using your immune system to recognize cancer cells, to eat it up. What we did was we took the same technology and we brought it over to Alzheimer's. And so we infused these antibodies that are designed to recognize the plaque. Right? The antibodies recognize the plaque, and they grab to it, and basically they, your immune system goes in there and kind of eats it up, Pac-Mans it. So in clinical trials are monoclonal antibodies that, in my view, are even better than what just got approved, aducanumab. Aducanumab is like the first cell phone. You guys remember the first cell phone? Was it the early 90s or the late 80s? Anyone remember? I don't remember. I don't remember. Right? So either early 90s or late 80s. The first cell phones, they were big, they were expensive, and they didn't work well. But every cell phone that came after that improved on it, didn't it? Right? Every cell phone that came after that improved on the first cell phone. Aducanumab, or Aduhelm, is the first cell phone for Alzheimer's. Everything that comes out in the pipeline, guys, is going to improve on that. That's what we have in the pipelines. Does that make sense to you guys? Right? Gail says, can you say what meds can be used for anxiety? Yes. For anxiety, we use typical anti-anxiety medications that's already approved on the market. They're not specifically FDA approved only for anxiety, but they're approved for the diagnosis of anxiety. And there are so many on the market. And it's not just anxiety, depression is a big factor that goes along with Alzheimer's, right? When as your Alzheimer's progresses, there's behavioral changes. So we have antidepressants that can be given for depression. We have anti-anxiety medications that can be given for anxiety. We get medications that help with behavioral changes. We have medications for agitation, right? Agitation is often a big component of Alzheimer's. The personality changes, the behavioral changes of Alzheimer's. They are not specifically approved for Alzheimer's, but they're approved for the diagnosis. So whatever your standard anti-anxiety medication, it can be applied to Alzheimer's. Whatever your standard antidepressant medication, it can be applied to depression. Same thing with agitation and things of that sort. Okay, does that make sense, Gail? Right, so there are a lot of typical anti-anxiety meds. That can be
Yes.
Xanax, that can be, lots of different things that are out there.
My neurologist wouldn't let him take any antidepressants. She only wanted Seroquel. And when I looked it up, I thought, whoa, that's like antipsychotic. And Don's not at that stage. So
Yes. And the problem is we don't have an FDA approved medication specific to behavioral changes and dementia or Alzheimer's, right? I mean, I take that back. We have one that's approved for like dementia and maybe insomnia, right? Like you can't sleep because you have, dementia. That's been approved. It's called Orexin, I think is the name, Orexin, insomnia with dementia. But that's about it. like agitation, anxiety, nothing FDA approved that's linked to both diagnoses. Wow, guys, it's 3:35. Should I turn it back to you, Melissa?
Sounds good. Thank you so much, Dr. Trinh. And thanks again, everyone, for being with us. Just as a point of clarification, since you had mentioned Alzheimer's Association and their role in lobbying for the drug, I just wanted to make sure everyone here knows that we are Alzheimer's Orange County, as you mentioned, and we're not affiliated with Alzheimer's Association. So we didn't have a role in lobbying for the drug, just in case anybody was wondering about that. But thank you so much for all your information and really fun class as always. And we hope everyone can join us for more in the future. And we hope everyone has a wonderful weekend. Anything else, Dr. Trinh?
Enjoy your weekend, everyone.